Hello. Today we will talk about how to control blood pressure naturally. Blood pressure, also known as arterial pressure, is a very important health factor. High blood pressure, or hypertension, increases the risk of heart, kidney, brain, and other organ diseases. Around 1 in 3 people worldwide experiences high blood pressure. Fortunately, scientific research shows that blood pressure can be effectively managed using natural methods. In this video, we will share science-based strategies, useful tips, and practical daily habits to help keep your blood pressure stable. 1. Reduce salt intake. Salt is one of the main factors that increase blood pressure. Studies show that consuming no more than 5 grams of salt per day can significantly reduce the risk of hypertension. Excess salt causes the body to retain water, which increases blood pressure. Scientific fact: according to the American Heart Association, reducing salt intake can lower blood pressure by an average of 5 to 6 millimeters of mercury. For people with high blood pressure, the effect can be even greater. Practical tips: reduce the amount of salt when cooking. Check processed and canned foods for sodium content. Use herbs and spices to enhance flavor instead of salt. 2. Maintain a healthy weight. Excess weight is a major factor in high blood pressure. Each extra kilogram can raise blood pressure by approximately 1 millimeter of mercury. Maintaining a healthy weight significantly reduces the risk of hypertension. Scientific fact: research shows that losing 5 to 10% of body weight can lower blood pressure by 4 to 5 millimeters of mercury in people with hypertension. It also reduces stress on the heart and other organs. Practical tips: monitor daily calorie intake. Eat fruits, vegetables, whole grains, and protein-rich foods. Limit fatty, sugary, and fast foods. 3. Physical activity and heart health. Exercise is one of the most effective natural ways to control blood pressure. Physical activity strengthens the heart and blood vessels, improves circulation, and helps stabilize blood pressure. Scientific fact: according to the American College of Cardiology, 150 minutes of moderate aerobic exercise per week, such as walking, jogging, or swimming, can reduce blood pressure by 5 to 8 millimeters of mercury. Physical activity also helps maintain a healthy weight. Practical tips: walk at least 30 minutes daily or engage in other physical activities. Simple home exercises: squats, planks, push-ups. Yoga and stretching improve blood vessel function and reduce stress. 4. Natural foods that lower blood pressure. Some foods have a scientifically proven effect on lowering blood pressure. Key foods: bananas, rich in potassium to counter sodium effects. Leafy greens, source of magnesium and potassium. Dark chocolate, flavonoids help dilate blood vessels. Nuts and seeds provide omega-3, magnesium, and potassium. Berries and citrus fruits, rich in antioxidants and support healthy blood vessels. Scientific fact: Studies show that regularly consuming these foods can reduce blood pressure by an average of 4 to 5 millimeters of mercury. 5. Reduce stress and practice meditation. Chronic stress is a major factor in raising blood pressure. Increased cortisol narrows blood vessels and increases blood pressure. Meditation, deep breathing, and yoga can lower blood pressure by 5 to 10 millimeters of mercury. Scientific fact: daily meditation stabilizes heart rate and blood pressure and calms the nervous system. Practical tips: meditate 5 to 10 minutes daily. Use deep breathing exercises to reduce stress. Walking in nature or listening to calming music is also beneficial. 6. Stay hydrated. Water helps balance blood volume and blood pressure. Dehydration can thicken the blood and increase blood pressure. Practical tips: drink 1.5 to 2 liters of water daily. Limit sugary and carbonated drinks. 7. Limit alcohol and avoid smoking. Alcohol and tobacco increase blood pressure and the risk of heart disease. Studies show that reducing alcohol can stabilize blood pressure naturally. Practical tips: minimize or completely avoid alcohol consumption. Quitting smoking improves both blood pressure and overall heart and lung health. Conclusion: blood pressure can be controlled naturally. Reducing salt intake, maintaining a healthy weight, exercising, eating beneficial foods, managing stress, staying hydrated, and avoiding harmful habits will strengthen your health. These simple daily practices can make your life healthier, more energetic, and safer. If you found this video helpful, please give it a like, subscribe to our channel, and leave a comment below. Your support means a lot and helps us create more useful content for you.